Right. Thank you so much, ladies and gentlemen, for being with us today. What we're going to do, this panel looks at the healthcare allocation, the budget allocation that was discussed yesterday by Honorable Finance Minister Nirmala ji. And joining me today are Dr. Anil Thakwani, Head of Department, Radiation Oncology, ShardaCare Healthcity. We also have with us Dr. Jothi, Neeraja, founder and MD, Maarga Mind Care and People Tree Hospital. We have with us, of course, Dr. Sanjeev Singh, Medical Director, Amrita Hospital. So welcome all of you. Dr. Neeraja, we are not able to see you. I think your camera and your mic is off. Right. So before we start, I'm just going to point out some of the key aspects before I bring in the experts about what was discussed yesterday. As I was telling my colleague Tarannum just now, the Ministry of Health and Family Welfare has been allocated a little over 1 lakh crore. So that's about 9-10% increase over the previous year. This year, the focus, of course, has been on building infrastructure, research, skilling, integrated healthcare system, wellness has been given a big push. I'm going to start by bringing in Dr. Sanjeev Singh. Can I have your view on what were the key aspects that really stood out for you?
Yeah, thanks, Jyotsna, and thank you, fellow panelists. Great to be here. Overall, I think it is a very fundamental and it lays down a strong foundation for a good healthcare delivery system. So it addresses more or less most of the things which has been asked by the industry and which has been a cause of concern.
Yeah.
What the point which you raised was the most important is an increase in spending. So right now it is 1.9%. If there is a crore additional, 10% additional funding which will come in, there would be close to 2.5% of GDP spent, and possibly 2.3%, 2.5% comes from the private sector. So it is a 5% GDP spent in Indian healthcare is not too bad. So it is in comparison to other Scandinavian countries, which is at 7 to 8%, and 16 to 17% of US is not too bad, and so we are getting there. So this additional infrastructure development or spending is important. Now it has been also given in National Health Mission. So it could be in a PIP mode, project implementation plan mode. It is also given an Ayushman Bhim program, which is an infrastructure of secondary care and primary care development, which we know in India that is an issue because the tertiary care and medical colleges are okay, but then district hospitals need infrastructural development. And then Ayushman Yojana itself, because in many of the states, the payments don't come in because the budget allocation has been poor. So now there would be an increase in budget allocation. So I think that is a strong foundation other than the research push, Ayurveda push, which is so very important because that's one of our hallmarks of our country. And then basically biopharma, where these drugs are making it very, very difficult for people to treat. So overall, I think it lays down a good foundation for a good healthcare delivery system. And we should really congratulate the government for doing that.
Yeah. And when you speak about the Biopharma Shakti initiative, so there's a 10,000 crore that has been allocated over 5 years, for viewers for biologics and biosimilar production. And these are domestically, if they are produced, so it would be lessening of imports. It is also ties into the research aspect that you were just saying right now. And of course, it also ties into larger employability and things like that, of course. Then, like you said, Ayush, there's All India Institutes for Ayurveda. There's going to be more focus on skilling, which I think is very important. I am going to get in Dr. Neeraja to talk a little bit about the Ayush and wellness push. Doctor, I think your mic is on mute. Okay, I'm going to bring in Dr. Thakwani till we sort out the mic for Dr. Neeraja. Dr. Thakwani, so good of you to join us. Please tell us what really stood out for you.
So, in the recent budget, basically 2026, a shift from volume-driven innovation to innovation-driven healthcare was a major thing which I observed in that. And they have invested around more than 10,000 CRs in a Biopharma Shakti initiative to make India a global biopharma hub. So basically, it focuses on a biologics, it focuses on biosimilars and clinical research ecosystem. And this is really a nice step which was taken by the government of India in this coming budget. Second thing is they have also concentrated more on oncology. They have made few drugs tax free so that the cost of like the treatment goes down. Along with the oncology drug, other non-communicable disease drugs were also included in the list. So these were the few I think steps which has been taken by the government of India so as to prioritize the healthcare system in the budget.
Dr. Neeraja, if I may come to you now, could you talk a little bit about the wellness push? I think there's something. Okay, so we'll try, and I'm going to get my colleagues to try and help out here. All right, coming back to there, Dr. Neeraja, good to see you.
I'm so sorry about that. Can you hear me?
Yes, we can hear you.
Oh, sorry about that. There was some problem with my video and camera. So good afternoon, all of you, and thank you so much for having me in.
Welcome. Could you tell us a little bit about what stood out for you from the budget announcement yesterday, and talk a little bit about the wellness push?
Yeah, sure. So I think this time I feel the budget was totally a little bit different because so much of importance has been given to healthcare. Healthcare has been brought to the front page this time. So that is very, it's a very welcoming move, and I appreciate the Honorable Finance Minister for bringing it to the forefront, first of all. And on top of that, it's very, very heartening to see mental health receiving its due importance. So as a healthcare leader, and especially I'm advocating, mental health, conversations, and to remove stigma in the country, and to create accessibility and affordability on the mental health front. I think what has been this time is really very, heartening to see. And I think there is going to be a real paradigm shift from here on, because always we have seen, mental health, we have to read it in between lines, or it would always been pushed to the sidelines. But now it's been given importance, and especially NIMHANS 2.0 coming to North India. Yeah, that is really a very, very, very significant move. I would really want to, thank the budget for doing this, because number one is, it's not only about the budget being allocated, a significant increase in the budget being allocated for the healthcare, but also the mental health being taken as an integral part of the entire framework. That has to that being taken as the core, and especially this being integrated in the district level hospitals, in the government hospitals, especially in the primary healthcare. What happens when we integrate mental health as a part of the core healthcare in terms of recognition, diagnosis, prevention, and in the primary healthcare sector, then that becomes no more a thing which is actually being sidelined, or which is being stigmatized, and that actually comes to the forefront. And creating the NIMHANS in North India, and then increasing the mental health the institutions in North India. What actually happens is we can increase the training, number one. training, increasing the number of, mental health professionals, which is the need. If you see in India, the number of psychiatrists is 0.75 per 100,000 population, whereas the minimum need is 3 to 4 psychiatrists per 100,000 population. So it's just not the psychiatrists, it is the psychologists, the counselors, the healthcare professionals, everybody. The training happens, accessibility happens, and affordability happens. So that, I think, is a very, very, a shift and an important move which has happened.
Thank you. There's something that I wanted to ask you. When you're speaking about how a certain number of psychiatrists per patients are required. That's the same, doctor-patient ratio, if you look at it. Your view on how, when this budget also spoke about, the underlying theme was digital technology, and integrating that into healthcare system so that we offer better care. And that has been something that we've been looking at in the sector in general overall. So please tell us a little bit about how that will help enhance the mental health systems in the country. And then I would come to Dr. Sanjeev Singh and Dr. Thakwani as well on integration of digital technology into healthcare and bettering care then through that. Ma'am.
Yes. So obviously, because there's not it is not only the number of psychiatrists, even the infrastructure, we are not yet there. If you see the infrastructure for mental health in India, we are able to cater less than 80 to 90% of the need. So we are able to cater, I would say, 10 to 20% of the need. The remaining 80 to 90%, we are not able to cater it in India because of the lack of infrastructure. So these telepsychiatry and telemanas and all the telemedicine programs will actually be able to bridge the gap to a certain extent, if not entirely, at least to the certain extent. So the majority of the population in the urban, in the rural and the smaller towns who cannot actually come to the cities, to the bigger institutions and to the little bit of the mental health infrastructure which is available in India, they could actually avail these services, to club it. Yes.
Dr. Singh, I wanted to ask you about the same thing, using digital technology to integrate into our healthcare systems to, so that people can afford better care. Your view on that, and especially you can talk about it from the angle of Amrita Hospital as well, because it's one of at the forefront of this.
So, Jyotsna, if you see, this is such a wonderfully crafted budget where you are looking at back to basics, providing manpower, increase in number of seats, giving enough revenue for budget for infrastructure. Yeah. And it is parallelly also working on research, innovation, technology, and that shift of building Make in India. So a wonderfully crafted thing. To your question, I think it is extremely critical that we need the data is the gold mine. And unfortunately, for everything, we still quote what is available in United States of America or UK or NHS. Until unless we get our own data, how do we do our own policy and advocacy? So that will only happen if it is digital in nature, because manually it is so big, it's so huge that it is impossible to get data out of the registers. Now, the step one is ABDM. So if Ayushman hospitals are registered, many of them are public, then there are private hospitals also getting registered. If everybody who gets into seeking healthcare is having an ABDM number and they are registered and has an ABHA number, and you have to, within ABDM, share the patient history across hospitals. So if he could be in Delhi and he could be in Nagpur, but then he does not have to go with the same investigations over and over again because it's all available. Yeah. So it's a fantastic thing. Second is the telemedicine, which eSanjeevani is a fantastic step which government has already taken, and it's really flooded. Yeah. The hospital information system, where all the operations aspect is also, if it is captured, you're capturing the supply chain, you're capturing your usability, you're capturing the bed management, the bed availability, the infrastructure. We saw that in COVID. We had no clue about the oxygen availability, the manpower availability. So all of it, if it is captured as an hospital management information system, it would be a fantastic way to govern healthcare. So that way, the technology push is immense, and it is, and we should give that credit to the government.
What you're saying is absolutely right. What could be one of the challenges in this area if we were to look at the technology aspect?
Don't ask difficult questions. The challenge is the doctor himself. Until unless the doctor who sees the patient in the outpatient and inpatient records it into the hospital information system or electronic medical record, even if I am going from Delhi to Nagpur, I will have no data because nothing has been recorded other than some labs and some images. So what is the fun in having a ABDM structure when there is a sketchy availability of data which gets entered? And that is what we have seen. We have worked extensively with Government of Kerala and Government of Maharashtra, creating an e-grid of linking all the medical colleges, all the district hospital. And we did that with almost 19 medical colleges. But when you open the unique hospital information system of a particular patient, there is nothing in it. So I think that is the biggest challenge, where you need to encourage people to also be an early adopter and adopt it in the interest of the patient and in the interest of capturing the data.
Dr. Thakwani, if I come to you on the same point, if we look at it, what according to you is the need? Like Dr. Singh said, that we need to encourage more adoption of digital technology into the systems. Your view, please, on this.
So, Dr. Sanjeev is right to say that now we are in that era that we should switch over to the digital technology in all the fields of medicine, basically, and especially I would talk about the oncology. So, basically, before incorporating the digital technology in our field, I think that we should need we need training of not only of the doctors but also the paramedical staffs, nursing, GDAs and all, so that they can also work on it. Like we were planning to make our department paperless, and in ShardaCare and Healthcity, to some extent we have made it paperless, but for that we need to be trained. So not only the doctors but also the staff. So small training programs should be incorporated in the routine schedules of all the workers who are working in the department, so as to take the maximum advantage of this the digitalization. So this is my view.
When we talk about, you're talking about how we need training, we need to skill people. The budget also had a whole thing on skilling and everything. If I look at medical education, if I pose a question to you, that in terms of medical education, what is it that we in India need to do more to get to our goals and to the level that we are aspiring to? So what would you?
Yeah. So basically nowadays we see, if we see the oncology, we are more into the personalized medicine, and it needs the incorporation of AI also. So I think that one subject of AI should be there in the curriculum of all the workers, be it a doctor, be it a nursing, be it a GDA, whatever, so that we can apply whatever the AI things are there, we can apply in that in our routine practice, all these things. Because you know that the role of AI is there in everywhere, like in AI in radiology, AI in oncopathology, and virtual tumor boards we are conducting, and they are helping us to take care of the patient who are at a remote places and who cannot come immediately and who needs a tumor board decision. So we are making we have also doing the virtual tumor boards. And apart from the predictive analysis, like this is also a part of AI. So all these things are there which help us in making our treatment more better than
and moving ahead. So coming to you, back to you, Dr. Singh, that when it comes to medical education, what is that one thing you would say that we must immediately sort of add or push a little bit more so that we can scale up?
So I think Prime Minister did go up to Red Fort and announced 75,000 more seats in medical education.
Yeah.
So we were all wondering why.
Mhm.
And then it is important because if you want to become a developed nation, there is a developed nation indicator which you need to adhere to, which is close to 3.4 population per thousand population bed ratio, or one doctor per thousand population. So with that, you need to increase the number of doctors available within the country. And that's how you fit into those definition. Now, this is fantastic. So it is 10,000 per year, 75,000 in 5 years. But imagine if you don't have a faculty in all these new medical colleges to train. There was only one All India Institute, now there are 24. There was only 300 medical colleges, now there are 818. And there are 12,000 PGs, now there are 78,000 PGs. The people have to be trained. And if they are not available, that's a disaster. So I think the missing point is the quality of medical education. Quantity they are achieving because they are opening up more medical colleges, they are giving permission. But there is nobody is talking about most critical portion, which is quality, and which is going to be very essential. Now, another point, Jyotsna, is that it's the medicine practice has always been a team practice. It is just not about clinician taking rounds. Clinician, nursing, and allied health makes a good team. And that is where this time also again they are stressing on nursing seat increase as well as allied health professionals being trained and skilled. And then you also know that there is another council which has come up for allied health, which has been approved by Lok Sabha and Rajya Sabha. In 2026, all these courses will be a uniform course. So I think moving in the right direction. The missing link is let's focus also on the quality of delivery.
Yeah, perfect. Quality of delivery, very important. Dr. Neeraja, if we talk about mental health and we talk about training and education and skilling in this area, what is that one aspect that you think that we immediately must push?
So in addition to what Dr. Singh said, what I 100% agree, it's not just the number of doctors who graduate and come out, but it is the training of the remaining sector of the whole crowd of healthcare professionals, like the nursing and especially mental health, the psychologists, the social healthcare workers. So what happens, it is a multidisciplinary treatment approach. In Maarga Mindcare, what we do is, like Dr. rightly said, it's not just the doctor taking rounds. So we have a team, a psychiatrist, a psychologist, a social healthcare provider, a mental health nurse. So all of them put together, it's like a teamwork. So they will be able to assess or analyze what exactly the patient needs, what exactly the patient goes through, and all of that. So what actually should be part of the training is training the entire cohort. So what we do in Maarga, I can just give a small example. We have some training programs for the social healthcare workers. So what we do, we identify an area and then we bring all of them to Maarga. So we have some training sessions. And then it's basically what I'm trying to say is, number one, training and also sensitizing the community and society. We also conduct training programs in schools and colleges, because if you see, the need is huge in the schools and colleges, the younger adolescents and the teenagers and the younger adults. So we actually go and train the the teachers and the lecturers and all of them to identify some kind of red signals within the institutions. So we also conduct some amount of training programs to the HRs, to the corporates.
Yeah.
Because that need is also huge, especially the younger, adults who actually start, working and earning. So these people are under immense pressure. And if as a society or as a group, if these things are not being trained and not being able to identify, then it is a disaster. Already we are in a disaster zone, but I'm very happy now these things are being spoken of, and there are kind of being created to integrate this. in the schools, in the colleges, in the corporates, and in the healthcare system. Especially the welcoming move, like I said, is in the primary healthcare, where we would be training from that primary healthcare, from the rural areas, the entire team,
Yeah.
how to identify and how to recognize some signals. And that's when mental health becomes a very core part of the entire healthcare system.
Correct. So now that we've discussed the key areas of what the allocation was, I have a question for all you experts. What is the advantage when we look at the Indian healthcare system as compared to anywhere else, like the NHS, for instance? So what are the key aspects where we are really strong? Let's talk about that. We're always talking about challenges in every sector. I mean, whenever there's a discussion or something happening, we'll always ask the experts what more can we do. We'll come to that. We'll wrap up with that. But before that, my question to you, what are the advantages that the Indian healthcare system has when we compare it to other systems? So, Dr. Singh, I'll start with you on this.
Very, very good question. I think we have the world's largest medical colleges globally.
Yeah.
We produce largest number of medical nursing. Not sure about allied health. We don't have the data. So we produce largest number of them. So they are there nationally. They are also have an international presence. Now, with this new Allied Health Council coming in, we'll be producing largest number of allied health science people to be employed nationally, again internationally. One thing which was very important and if you see with the President of United States, who is so mercurial, who we don't know how do you prepare yourself. Make in India is so very important. And then all this modern medicine has its all work being done elsewhere, very limited. Ayurveda and Ayush is ours.
Is ours, yeah.
And that is the strength. And we have not been able to capture the strength only because documentation has been poor. We have been treating well. We have fantastic Ayurveda physicians, Nadi physicians, homeopathy, but unfortunately they didn't document it well, and they didn't go through those phase 1 to phase 5 trials and research. And so the trust towards yes and no was not there. So there is a lot of push because that's ours, and a lot of it is patent, which belongs to us. And that is what should be again sort of promoted. There is also a lot of push with respect to internal building. So we are the pharmacy capital of the world. We have the largest APIs of the world. We produce almost 42% of what we also export. And if that is the nature of our production, then why not do similar thing for the most advanced biosimilars and biopharmas, and the things are changing, and those are all need to be available. And if that also can be done internally, that would be so very, very important. So I think there are lots of positive. The demographic dividend of young people, young doctors, young medical, young nursing, young being available to us is again very important. And then there is huge investment now coming in for research, because unfortunately we have always been following what the West does, and the West gives us the research ideas. Now there is a focus because there is a budget and for research and innovation, and that is how the new research questions will be asked, the innovation will happen, which would be definitely cost effective, because a multinational company who has insulin pump is 3.5 lakh rupees. An Indian company which has an insulin pump is 25,000 rupees. It is going to benefit so many people. So a very frugal way of research and innovation. So there are a huge number of positives in our country, and I think we should capitalize on it.
Absolutely. Dr. Thakwani, let's hear from you on advantage of the Indian healthcare system? What are advantages?
So most of the advantages has been already enumerated by Dr. Sanjeev Singh, but I would like to add one more thing to it: the medical tourism. So medical tourism and an integrated care model, because we are providing that all the medical facility at a very cheaper cost and at a very good quality. So a lot of patients, apart as far as oncology is concerned, thousands of patients are coming per year from different parts of the country to India to get the treatment, and there are many advantages for them to come here. One is that they are planning their visit to India. They are going to India as a tourist also, apart from the treatment. Apart from that, they are getting the treatment at a very cheaper cost. Good quality of treatments is being provided by the corporate hospitals, which are there nowadays in our throughout our country. And apart from that, they are getting appointment immediately. They don't have to wait for a long, as compared to if we compare it with the US or from the European or West countries. So they are getting appointment for around a year, 6 months. But if they come to India, they get immediate appointment within a week or next day also in many hospitals. So all these are the advantages what the foreigners who are coming for the treatment to India, they are getting.
That is true. That is true. What you said is absolutely true. In other healthcare systems in Europe and things like that, even as a regular patient, it takes you so many months to be able to see a doctor and move forward with your treatment plan. But you're right. So now, I'm going to come to all of you for your closing remarks, because we've had a nice thank you for your time and So, but let's go with the closing remarks. Dr. Neeraja, your closing remarks on where we're at, what we need to do, what can we do better?
I think of going forward from here on, we are in a very good position. And I would once again want to reinstate that getting mental health into the forefront is a very, very warm welcome. So if you want to ask me, one closing statement from me is integrating mental health, physical health, and financial health of the country is the key for economic and social resilience in India and for sustainable growth. That's one statement I would want to close with.
Thank you. Thank you. Dr. Singh, your closing remarks. Where are we? Where are we? Yeah.
So I think we are doing well. We need a huge infrastructure. People need to go to the rural areas and man the PHCs and the secondary care. Because if 68% of them are still in rural, why are they unattended? So what do we need to do to have people be present there? We need to incentivize, and that should be one of our policies, because that is one big chunk which is sort of left unattended. And that is where I think the second point, which is critical, is health, unfortunately, is a state subject. So you are left to some states who will agree. Like Ayushman Bharat is the world's largest insurance, such a fantastic program. Some of the states don't adhere to it, and they don't pass on this benefit to the public. And even if you have a national policy, state may adopt it, state may not adopt it. So just like finance budget, can there be a health budget where it is national in nature, and then state can pick in, still have some kind of federal nature? Because if we just leave it to them, and every time we say it's a state subject and it can be done, it may not be done, some do, some don't. I think these two things we somewhere need to, as an infrastructure and framework, may have to address.
Yeah, I like that it should be, they can just plug into it then, instead of just leaving it as a state subject.
So Jyotsna, we were meeting the health minister, and we thought we are asking a very intelligent question, and we were telling him, why 1.9% GDP? Why don't you spend more?
Yeah.
And very simply he asked, I give money to the state, they give me back, and you are asking me to spend more? I think that is where we are possibly going wrong.
There's that disconnect, I think. Yeah. So the very, very, very valid point. Dr. Thakwani, your closing remarks.
Yeah. So looking at the health budget, by the government of India, I was very much enthusiastic. So I would love to say that future of oncology in India is not just about the new drugs only, because they have given a lot of discounts on the new drugs, but about new systems also, systems that make innovation accessible, affordable, and equitable to all the residents of India.
Perfect. Thank you so much. Thank you, everybody, for being here, for discussing all your and giving us all these wonderful ideas and your time. Thank you.
Thank you.
Thank you so much.